we look at this particular new variant, we don't know much about it itself. So we don't really know how it behaves. We don't know how it is, how transmissible and so on. Those estimations will come with time. But what we can do is we can extrapolate based on the mutations we are seeing. And so we can get some idea of what's the likely scenarios, and we can plan and we can prepare and respond based on those likely scenarios. And if you look at the likely scenarios, well, there are a whole range of mutations that we know well. We know them well because they are already in the alpha, beta, gamma, and delta variants, and we know what they do. We know that, for example, a set of the mutations and deletions that occur are responsible for changing the way one particular PCR test responds. And so it becomes a marker that helps us identify it. We know that some of the mutations we see in this particular variant are also in the Delta variant near the furin cleavage site, and so they enhance transmissibility. So we can expect this new variant will have enhanced transmissibility. We know that this variant has some mutations similar to the beta and gamma variants that are responsible for some level of immune escape. So we will expect that there'll be at least some partial escape from antibodies. So we can predict this or put it together a scenario based on what we are seeing in the mutations. But there are some mutations in this particular variant that we have just only slight information about. We don't really know fully well what they do, but we have some inkling. And then there are a whole lot of mutations, we have no idea what they do. And so a lot about this variant, we simply don't know, because this is a constellation. It's not about only the individual mutations. But what can we reasonably expect from this particular variant, and how will it impact the key elements of our response? So let's look at that. Let's look at, are our current diagnostics going to be effective? Well, it's picked up on at least 2 of the 3 genes in the Thermo Fisher kit, so we expect that it would do quite well. Our diagnostics should function well. We've got no reason to be concerned, hence the smiley face. In terms of clinical presentation, there's not enough data yet. We've seen some anecdotal information, we've seen clinicians commenting, but you have to understand that patients coming into a clinical setting are biased in terms of their severity and what we are seeing. What we are seeing is anecdotal information suggests similar presenting illnesses, mainly in younger people for obvious reasons, in that younger people are less vaccinated, so you will see more cases there. But we simply do not have sound, reliable data on the clinical presentation, but we have no red flags that have been raised so far. So we can't be complacent. We need to monitor the situation. We don't know where we stand, so no smiley face, but we're monitoring that. And we should have more information on this, and some of which you will hear in the course of this briefing. The third is, our current treatment still effective? Yes, smiley face, because we know that most of the things we use in our standard treatment protocols should be effective. There's one area that's not clear, and that's on monoclonal antibodies, and that remains to be tested. We don't really widely use them in South Africa, so they don't really impact on us. There's new potential treatments coming into play, like Paxlovid. I won't go into that because that's more complicated to share with you, and I can always cover that in later time. So as far as diagnostics, clinical presentation, current treatments, we've got really no reason for concern. What about our public health interventions? Our public health interventions all work. Social distancing, ventilation, all the usual things, they work. The area that has created the concern and this global overreaction is that we're not sure about whether the current vaccines will protect against this new variant. And there's some evidence, preliminary as it is, that we can see that the mutations that occur may confer some level of immune escape from antibodies. And so we can expect that we may see more reinfections, so those who've had natural infection without being vaccinated, We may see them getting infected again because this variant will bypass some of that immunity. We may see that in terms of the antibodies generated by the J&J Pfizer vaccines, we don't know how that will respond. It's left to be seen. We'll know definitively, and probably take us a good 2, 3, maybe enough to 4 weeks to get those answers. But based on what we know, and based on how the other variants of concern have reacted to vaccine immunity, we can expect that we will still see high effectiveness for hospitalization and severe disease, and that protection of the vaccines is likely to remain strong. Now, I don't know this definitively. The studies are being done, but based on what we know, we can expect that this is the likely scenario, that the vaccines should hold well in terms of preventing hospitalization, severe disease, because they depend more on T-cell immunity and less on antibodies. So even if there's some escape from antibodies, it's very hard to escape T-cell immunity. So that's the likely scenario that we are to see, I'm expecting.